Good afternoon, everyone. My name is Irene Mbari-Kirika, and I'm the founder and executive director of inABLE. I'm really excited to have one of my dear colleagues in the industry here with me to speak a bit more about assistive technology, because it's a critical part and component of disability. And if we don't address assistive technology across Africa, then persons with disabilities will not have access to information, to services, and to any other products. So I will give my dear friend Pascal a chance to introduce himself first.
Hi Irene, it's great to be here. Thank you for having me and having ATscale being part of this amazing event. So I'm Pascal Bijleveld, and I head up ATscale, the global partnership for assistive technology.
Fantastic. Please share with us the role of ATscale and what type of problem are you trying to solve when it comes to assistive technology, whether it's in Africa or whether it's global. Please give us a bit more information there.
Yeah, so ATscale was really born out of this realization that we were facing a completely unacceptable and quite shocking situation when it comes to leaving no one behind, which is fundamental to the Sustainable Development Goals and so on. And more particularly, leaving no one behind from an inclusion perspective, because of a lack of assistive technology or access to assistive technology, which, for those who may not be familiar with what it is, it ranges from things like eyeglasses or hearing aids, but wheelchairs, prosthetics, but also, and increasingly importantly, digital devices, smartphones, apps, screen readers, and so on and so forth. And so the situation, and I feel like a broken record a little bit because I've been now saying this since I began taking on this and leading this initiative. The situation is that in higher income countries, most people who need assistive technology can access it, close to 90%. In lower income country, that's as low as 10%, and sometimes even lower, right? So you can see that massive inequity. And I sound like a broken record because I've been saying this for a couple of years now. And I really look forward to the day when we can start speaking about different numbers that are bridging this gap, and that is the purpose of ATscale.
Fantastic. Thank you so much for that and for sharing the numbers, because if in the first world you have access to about 90% of the people can access assistive tech, while in developing countries like in Africa, 10%. That means we have a lot of persons with disabilities who are disconnected from the rest of the world, who can't access education, employment, healthcare, and everything else. So I do think that it's something we need to focus on as a community, as governments, as private sector, because bottom line is you can't employ someone if they don't have the assistive technology. So it's really a collaborative effort, and it has to be addressed from all angles by everyone from all sectors and industries. So thank you for that. So my question is, what type of impact are you trying to have based on what we've just discussed?
So as you rightly mentioned, bridging that gap is going to require a real collective effort, bringing together the private sector, government, civil society, organizations of persons with disabilities, academia, really all the different key stakeholders to make that step change. And it also requires, so all these different partners, but then it requires looking at this from a real holistic perspective, trying to really tackle the fundamental barriers. And the easiest, or one of the ways that we're framing this and thinking about this at ATscale is really we are facing a what's called a market failure in economic terms, where supply and demand are just not matching, right? So you have a lot of products. You've got now relatively inexpensive eyeglasses that are available globally. You have great wheelchairs, and you've got, amazing now capabilities of smartphones and so forth. So you've got supply, but those products are not always adapted to specific contexts that we find in lower income countries. The pricing is all wrong and often unaffordable. But then also on the demand side of things, there's a real lack of awareness, right? About what assistive technology is, what it can do, how you can access it. There's a lack of skilled workforce that can actually screen persons that feel they may have some impairment, that can then prescribe the right assistive technology, that can fit it properly, that can follow up. It's a whole ecosystem that you need to build, right? So it's looking at this from a market perspective and working with the industry and getting better products out there, but then looking at the whole system. And that's what we really want to change with ATscale. So we care about reaching people, and ultimately we have this ambitious goal of trying to reach 500 million people by 2030 across the world. It's not just in Africa. But as importantly, if not more, it's about how do we do that in a sustainable way, right? By really strengthening the system. So that when ATscale goes away or other partners go away, there is a working, functioning, sustainable system in place that will guarantee access to assistive technology to all those who need it. And I think another important really point to emphasize is that while persons with disabilities are a really important group who typically often use more than one assistive technology, it goes beyond persons with disabilities. We are an aging population across the world, and we know that with age, often disabilities arise, right? Now I need reading glasses, which I didn't 2 years ago. Perhaps in a couple of years I may need a wheelchair or a hearing aid or something to help me function. I may not consider myself living with a disability, but I'm an AT user, right? And it's the same with school kids who may just need eyeglasses to be able to see the blackboard and be able to, successfully complete their schooling, right? So it's really something that concerns everyone.
Fantastic. I think you've mentioned multiple issues in what you've said. One of them is just product market fit. And I think Africa struggles with that piece because what happens because of lack of manufacturing of assistive technology in Africa, what happens is we get a lot of importation. And sometimes when you have all these importations, even though the idea is fantastic, but if you get a wheelchair that's not made for the African terrain, like my village, then that wheelchair will not last. So you hear stories where within a year, a wheelchair is damaged. There's no way to fix it. There's no capacity. So I think based on what you said, especially about working on the ecosystem and strengthening and understanding what can be imported, what can be manufactured locally, and just having a proper system in place that I think that would be very helpful and helping strengthen the market. Like you said, there's lack of awareness and people using the wrong type of assistive tech, which makes their disability worse. We've had a lot of that during this conference. So I think there's a lot for us to talk about there, and I know we'll continue with these conversations on a quarterly basis to see what can we do to really solve the issues of assistive technology in the African continent. So that's fantastic. I think something you forgot to mention, or maybe I didn't ask, is tell us a bit more about World AT Day.
So World AT Day is a fantastic opportunity to celebrate assistive technology. And we established the first World AT Day last year. It's on the 4th of June, so it was yesterday, and it was fantastic that we could be here at Inclusive Africa to celebrate that. And so we actually started it last year in the context of a global campaign that we launched called Unlock the Everyday, with over 40 different partners around the world working together to really increase the visibility around the need for access to assistive technology, as, I should say, not just a right, but also a smart investment, right?
Yes.
Because there is a real return to society.
Yeah.
So World AT Day really aims to raise the profile and visibility, to generate more political will, to share the amazing successes and achievements that are being accomplished, because there are many, and to really bring out the voice of AT users. And we're really hoping to see this as a growing movement year after year. So we're already really excited that yesterday, I think there were events happening in over 50 countries, over 100 events, thousands of social media posts shared, and we already know that millions of people have already been reached through that. So that's a lot more than last year, and it'll be a lot more next year. So we'll just keep on going together on that journey.
Yeah. No, thank you so much. And as Inclusive Africa, of course, we are happy to be part of this movement. And I think the awareness is super critical, both for governments, private sector companies, because sometimes we tend to think that AT is just for the NGOs, the disability community, but it's very, very important for private sector to get involved because they need to invest in that space. If they're even going to be inclusive, this is part of what they need to be doing. And are there any latest developments about ATscale you'd like to share? Anything?
Well, yeah, I mean, we're still, sometimes I still consider ourselves a startup. We've been around just for a couple of years, and so we're constantly growing and evolving and staying agile and responding to the growing needs. We are excited that this year we'll be launching programs in about a dozen new countries. Many of them will have a particular focus to begin with on school-aged children. As a particular population group, and around vision and hearing. So stay tuned for progress on that front. We're also super excited about an emerging partnership that has been in discussion over the past couple of months with the International Finance Corporation, part of the World Bank Group, GDI Hub, UNICEF, and other partners to really look at this key issue that you raised earlier, Irene, around how do we build sustainable AT markets so that these products can be manufactured closer to where the end users are. Now, let's just be careful here. It doesn't always necessarily mean local production, and we shouldn't, always think, okay, import is bad, local production is good. It has to make business sense. Yes. Right. And so it's going to be a journey. It's going to be a whole trajectory. But I do think that there are a lot of opportunities because it's true today. Nearly 100% of AT is imported. And I think we can do better than that. And create a better and stronger ecosystem around that. So these are some developments. There's more going on, but
No, I completely agree with you. Most AT is imported. We have to do some local manufacturing, but it has to make business sense at the same time. So I think that's something important to note. But maybe one last question for you. If you two questions. Number one, can you name some of the African countries where you're working currently? Maybe start with that.
Yeah, so right now we have ongoing programs here in Kenya. And we're very proud that also Kenya is represented on our board. We have a program in Rwanda as well that's ongoing, and in Senegal. We had a program in Zambia. Sadly, it had to be stopped because of the funding cuts from USAID. So as with others, and this sector hasn't been immune, sadly, to this situation, we have been impacted by a changing landscape on the international scene. But we are looking to begin programs this year in Ethiopia, in Nigeria, in Tanzania, and I may be missing some, but that's...
No, that's fantastic. I'm actually happy to hear you're doing some work in the French-speaking countries because sometimes we focus more on the the Kenyas, the English-speaking countries. So it's great to know that you have something in the French-speaking countries. Last question for you is: if you had a message for African leaders, what would that message be?
I would have many things to say. But I think more humbly, invest in your people, and invest in everyone, and begin with the most vulnerable, the most marginalized, the ones that are in the hardest to reach areas. Because if you can reach those, you can reach everyone, right? And it'll pay off. It's a smart investment. So I think that for me, and that includes then investing in assistive technology and in investing in living up to the commitments that most African countries on the continent have made in the context of the Convention for the Rights of Persons with Disabilities. I guess that would be
what you would
an
say.
important message.
Yeah, and maybe in closing, what I would say is being an African and knowing that based on the World Bank and the UN, that 15% of any population has some form of disability. In Africa, we have 1.4 billion people. And we also know that 80% of those with disabilities live in poor countries. So there's definitely a need to invest in that space. There's a market, there's a population that needs to be served. But currently, you said it's less than 10% that have access to assistive tech. So there's an opportunity there, and I'm also encouraging even VCs and funders who are not in the AT space to really consider just coming in to learn more and see what we can do together to really jumpstart this market. Fantastic. So it's been a pleasure having you, and thanks for being our partner and joining Inclusive Africa Conference. Thank you.
Much appreciated.
Thank you
so much.
Thanks. Take care.